There's a fundamental problem with how we manage Dupuytren disease. For many people, treatments fail over time. The good news is that there is a clear path forward to developing better treatment options to reduce the need for surgery and other procedures for Dupuytren contracture. I'm Dr. Charles Eaton. I'm a retired hand surgeon and executive director of the Dupuytren Research Group. We are a nonprofit organization conducting medical research to advance the diagnosis and treatment of Dupuytren disease. I want to share with you what we're doing, why we're doing it, the progress we're making, and what this means for you. As a Dupuytren specialist, I've treated thousands of Dupuytren patients. Recurrence after treatment is a big problem. Repeat procedures don't work as well or last as long. Dupuytren biology progressively damages the hands despite our best procedures. This is what Dupuytren contracture can look like: bent fingers and tight palms. Infinite variations, but instantly recognizable. Dupuytren is a frustrating personal burden that's often hard to describe. Bent fingers can get in the way all day long, every day. It can be painful. It can interfere with keyboard use and fine dexterity, and social anxiety with appearances, and anxiety about an unpredictable future for the person and for their family. Dupuytren is a medical disease. It runs in families. It affects more than just the hands. It progresses slowly. The only reason surgeons are involved is that there's not yet a medical treatment to turn off the disease biology, so surgeons get called in to manage the complication of Dupuytren contracture. The current model of Dupuytren management is damage control, not disease control, not prevention. It's not a great model, but we can do better. Dupuytren is as common as colon cancer. It's as common as all autoimmune diseases combined. If you have it, each of your kids has a 50-50 chance of getting it. It can skip generations, it can hide, but it'll keep popping up in the family. It's unpredictable over time. It varies a lot from person to person. We know that children can have much more severe Dupuytren than their parents. All of today's common Dupuytren treatments are just new versions of old techniques. None of our treatments control the underlying disease. None of our common treatments prevent progression or recurrence. And recurrence is the main reason for bad long-term outcomes. We don't have a test of individual Dupuytren biology, and so we can't predict if someone's going to get Dupuytren, even if it's in their family, or whether it'll get bad enough to need a procedure, or whether it'll recur after a procedure. Recurrence moves the goalposts from, I want my finger straight again, to, I want my finger better than it is now, sometimes to, I give up, and sometimes to, I want this finger gone. Recurrence is the most common reason for someone to decide to have their finger amputated. We have to prevent recurrence. But if we can't predict what's going to happen with any accuracy, we can't test preventive treatments with any accuracy. Right now, there are dozens of potential preventive Dupuytren treatments ready and waiting to be tested if we could measure a person's individual Dupuytren biology and how it responds to these therapies. A predictive test could guide preventive treatment of someone who doesn't yet have a contracture. It could help match the best procedure to the individual biology of someone with a contracture, and it could help manage treatment to prevent recurrence after a procedure. This is how biomarker-based therapies for other diseases work in real life. We just need to bring Dupuytren to the same table. Rheumatoid arthritis is a good example of how a predictive blood test can help develop treatments that reduce the need for hand surgery. Scientists found a blood protein that was called TNF, that was abnormal in severe rheumatoid arthritis. Enbrel was a drug developed to neutralize the TNF protein. It worked. It prevented rheumatoid biology from progressively damaging the hands, and the proof was fewer people needed surgery. We have the potential to do the same for Dupuytren, develop preventive treatments to reduce the need for Dupuytren surgery. Right now, we don't have a predictive test. We can only measure finger joint angles, and that only shows what's already happened. We need a predictive test to develop preventive treatments. 80% of heart attacks and strokes are preventable, and we know this because cholesterol is a predictive biomarker for heart attacks and strokes. A biomarker is something in the body we measure to show what is happening inside us. Predictive biomarkers change long before any physical changes occur. They enable treatments that allow people to take control of their individual biology and prevent disease complications. Even more critical for Dupuytren, biomarkers make research efficient, affordable, and fundable. Dupuytren research is chronically underfunded because fiscally responsible funders who understand chronic disease research will only give major grants to cost-effective biomarker-based studies. Finger angles are not enough. A Dupuytren biomarker test is the path forward. The starting point in biomarker research is a test of whether or not someone has a condition, a diagnostic test. And you might ask, why? You can diagnose Dupuytren just by looking at it. Well, that's mostly true, but a diagnostic lab test can give far more information than you can get from physical measurements. The next step is a predictive test. Is Dupuytren going to keep damaging the hands? Is a treatment changing the odds of this? We began our research because there was neither a diagnostic nor a predictive test for Dupuytren. Our research has changed this. We have developed a preliminary biomarker panel that correlates with diagnosis and with biological severity, a world first for each, thanks to your support. These are preliminary findings. We have to confirm these results with a larger validating study. Once we do this, we'll make this test available to the global research community to test existing therapies, to develop new treatments, and to pharmaceutical companies to help bring these to market. We are the only group in the world developing a snapshot test of an individual's Dupuytren biology, a test to be able to tell if a person's medical treatment is working to control that biology, to prevent contracture, prevent recurrence. And we are ready to go. We are in the right place, at the right time, with the right tools and expertise to transform the model of Dupuytren disease management. It's the right time to fund this project. Charitable giving has brought us this far, which is amazing. But with the recent loss of government funding for medical research, any further progress depends on private funding on a larger scale. We seek your support so that millions of people can have less uncertainty about their future and more effective long-term options to control their Dupuytren. Thank you for your time, and thank you for supporting this important work.